Well, I mean, it's just so obvious that we spend so much more as a country and learn and get such worse outcomes because we are so poor at prevention. Even in how we use the language to describe our healthcare system, it is a healthcare system. I once was the head of an organization, and still am, called the Washington Health Foundation. People
Mm.
ask me, how come you're not the Washington Health Care Foundation? I said, because we aspire for health, not for health care, right?
Yeah,
And sort of
right.
getting at, again, this tension and what we really is the right thing to do. Again, I would go back to my set of solutions, which get into the practicality of trying to organize this around from a person point of view, which would pretty quickly say, if you want to just use one example, that, well, gee, if this person has diabetes, wouldn't it be way cheaper to make sure they get their insulin than somehow wait until they need to have their foot amputated, have a coronary, have stroke,
Yeah,
eye disease, the problems go on and on. And there's just example after example of that type of thinking, and trying to incorporate preventive thinking into our current system just runs into a loggerhead with the way the system's structured. Right now, we're seeing a pushback. Just this week, there is a Supreme Court agreeing to hear a case about the prevention elements of the Affordable Care Act that
yeah,
require these prevention policies in the Affordable Care Act insurance policies.